Can somebody tell me if we are on in Hush? Hello, hello. So, hi everyone. Hi in Hush. Um, are we on there? Click the heart button so that the video gets bumped up and it notifies everybody who has their notifications on. Um, yeah, okay. I see it. I see it. Yay, we can start. So, happy Sunday, everyone. And we have a special guest today. We have Doc Dale C. She is winner of 2019's 5 by 5. What's it? What's the name? It's not Reach eh. Uh,
Ah,
Lima yun eh. Siyempre, hindi ko na maalala. I'm
empower,
so
empower.
sorry. So, Empower. 5 by 5 Empower our awardee for 2019. And she's also our platinum. Newest platinum.
Yay!
And also, she is a pediatrician and she has a big heart of gold and service and oh my gosh, mind blown. Parang every time I think about the work that you're doing with the kids and in the provinces and in your practice, naiiyak ako. I remember
Oh,
parang lagi kami
ang
umiiyak kami
aga,
na
ang
Coco. Ang
aga
aga,
para
iyak
para
agad, no? Parang, and then I'm so honored that
mamaya
you're
na.
speaking with us and sharing all your expertise, especially about oils and kids, which is dear to our hearts because that's where I started also like using oils for my family. And I hope today's class will empower everybody to really look at natural health and essential oils as a big part of their toolbox. So without further ado, I'm gonna turn you over to Doc Dale. All right.
Thank you,
So
Rachel, for that very wonderful introduction. Parang that's too much. Yeah, that's okay.
iya ako na agad.
Okay. All right. So a blessed Sunday to everyone. Hello, hello. I like to greet everyone lagi. Good morning. So good morning kasi iba yung energy pag morning. So I'm Doc Dale. They call me Doc Dale. I am a pediatrician here in Naga City, here in Bicol. I have three children, 9, 8, and 4, all of whom are oily kids. No, and I have one husband. One husband. Can be a little nega sometimes with oiling. But pag sumakit naman yung tiyan niya, ano ba yung pwedeng ilagay mo sa tiyan ko? Something like that. So, I'm happy with that, no? Okay, so today I'm gonna share with you from the heart my personal and my expert opinion and experiences with my own children, with the children of my friends, and with my own patients. Okay, how we handle some of the most common kiddie concerns. Okay, how the parents and I really collaborate to the best way we can so that we can give the best care for our children. Because remember, your healthcare providers are there to give you advice on what they've studied, but they you need to help us also. So it should be a very good collaboration. You should communicate very well with your doctor so you give the best care for your children, the best individualized care for your kids. Okay. And with that, you can truly um, heal the body from inside out. Okay. Because if there's no collaboration, you'll just treat all the superficial stuff that we don't like, that because it will keep on coming back. The symptoms will keep on coming back if you don't collaborate and if you don't heal from inside and out. Okay. So before we proceed, I'm gonna tell you 5 very important things when it comes to trying to address the most common concerns of our kids. Actually, even for adults, no. So, Rachel, can I share? Can you share screen?
yes,
Do I
go
have?
ahead.
Yeah. Okay.
Yeah, you have access.
Actually, this is my one and only slide. Okay, so I don't have any other slide besides this, no? So please, very important that you have a notebook with you and a working pen so that you can take notes. Okay. All right. So first and foremost, every child is unique. Okay. So I may be a pediatrician, but I work closely with the parents of my patients. Okay. So each child can be different. So whatever works for my patient and their parents and their setup might be different from your setup, might be different from the preferences of your kids. So it's always individualized. Okay. So okay, I'll open it for you. Oh, sorry for a while. My daughter is wants to make slime. Okay, slime is life. Okay, so each child is unique. So you need to listen to your child. You need to know your child very well because some of the protocols might work differently on your child. Okay, you are the best person to know which one will work, which one will not. Okay, and even my own kids actually they have different preferences what more your kids. So my youngest, she can tolerate, even if she's 4 years old, she can tolerate minty oils, but my eldest and my second daughter cannot tolerate any dab of any smear of minty oils. Okay, so each child is different, so you need to really um, know which one will work best for you and your family. Okay, and secondly, correct education is the key. So I'd like to congratulate everyone for attending this class, because really attending classes, reading trustworthy and unbiased resources will really help you to take charge of your family's health. Okay, so knowing the safety tips, especially if we have new members here, you read about safety tips. That's key, and you dilute. Okay, especially for those who are newbies who are just starting. You start low and slow. We used to say that a lot starts low and slow. So me personally, um, I don't advise undiluted oils, even lavender on newborns. You really need to still dilute them. So so we are more on the safer sides. Okay, and reading actually makes you realize that you really don't need to be an expert like me. You don't need to be a doctor. You don't need to be some professional who loves to read just so you can use the oils. Okay, so you don't need to be a super expert. You just need to be proactive. So you read from trustworthy sites, because I don't know if this is gonna sound okay with some of our members. Oiling is just common sense. I'm always telling that it's just common sense, and you don't need really a degree to get common sense, diba? You don't dump thieves on your child who's sick, diba? That's not common sense. Okay, give you don't let your child ingest uh, lots of drops of oils just for their digestion to improve, no? So oiling, it's just really it's simple. You should not complicate things, no? And there's a lot of, for those naman who loves to read, or if there are also healthcare providers here in this class, there's really a lot of medical research about the benefits of essential oils. Magsasawa kayo sa dami. Super, super dami. There's just very limited though when it comes to kids. Actually, even pharmaceutical medications, there's not so much research on kids because children, they are a vulnerable population. So the ethics committee of research boards will not really approve immediately of that research when it involves giving medications or trying medications on kids. Okay, so for me naman, as long as it's working well on my kids, I don't see any side effect, and it's okay also with my patients, then that's okay. Okay? Number 3, Actually, this is my favorite. True healing is balanced. So oiling, actually even medications, no, it's just a slice of a pie. Okay, so it's just part of a whole. You you True healing starts when everything is balanced. Everything is about balance. Okay, so you need to control your diet. You need to, if ever there's allergy, you need to control the environmental triggers. Okay, you need to be active. Okay, so you cannot just really use medications or use oils for one concern. Okay, it needs to be a collaborative effort on all aspects of your life. Okay, so you cannot really say that the oil is not working, or even if you're taking medications already, you can't say that they're not working if you're not trying to address other problems, other aspects of your life also. So the key here is balance and holistic. Okay, and most common kidney concerns from my experience can all be addressed with a holistic approach. Okay, so kaya a lot of my patients, we can handle them at home because I inform them that other aspects of their life should be addressed. Okay, so later on also when we go to allergies, you'll see why treating eczema superficially will not really work. Okay, because you're not addressing the root cause of the problem. So later on we'll go through that. So that's part of a balanced holistic healing. Okay. Number 4, okay, no emergency signs. This should be anywhere in your house. You should post this, you should write this. No, kasi pag natataranta na, you don't really know what to do, okay? Everything that I'll talk about later on will be non-emergency cases. Non-emergency, okay? Meaning non-urgent, non-life-threatening concerns. Okay, what are these emergency signs? Okay, can you please list them down? I'll tell them to you. I just didn't have the time to make a slide, but the emergency signs are this. No, so signs of um, decreased oxygenation in the brain. So pag nabawasan yung oxygen sa brain, you can have seizure. So you should know that seizure is an emergency. So when I say emergency, it means you need to bring your children to the nearest hospital where there is a doctor that they can physically evaluate your child. Okay, so changes in behavior, okay, or really high grade fever. High grade fever for maybe 2 or 3 days. High grade is 38.5 and above. Okay, yung mga 39, 40s yan, matataas na yan, no? So if it's not coming down in 2 or 3 days, maybe you need to really bring your child to your doctor. When it's a newborn, other signs of severe infection like brain infection. When it's a newborn, you try to feel their fontanelle, bunbunan. It should not be bulging. Okay, if it's bulging, then there might be some brain infection already, and you really need to see a doctor for that. Okay, other signs of dehydration. So signs of dehydration, the lips are very dry. There's little pee, there's little urine output, and the urine is very dark orange, no? So may wee pero it's very dark, so it means the child is dehydrated already, and maybe you need really to put na an IV line to prevent the dehydration. Okay, so if there are some signs of difficulty breathing, like mabilis yung hinga, fast breathing, and then the nostrils are opening, closing, so bumubukas-bukas yung hole sa nose, no? And the child is getting very pale or getting purplish, no? Those are emergency signs also. Signs of decrease in sugar, especially for newborns, for babies. They don't cry much or they're not so active anymore. So pag ang baby mahina ang iyak, it means there's something is wrong. Okay, they should be crying very loud. Okay, and poor activity also, it's a sign of lowered sugar concentration in the blood. Also, when there's signs of poor circulation in the body, so lumalamig yung kamay, yung paa. Okay, but sometimes when our kids, you'll know that your kid will have a high grade fever when their feet is getting cold. Okay, that's quite different, no? Because for those who are compromised, the circulatory is compromised, no? So there's less oxygen in the body. Lumalamig talaga. Arms and legs are getting cold. Okay, so those are the most common signs na you need to bring your child to the doctor already, or any swelling. I'm seeing a lot of ngayon wound na nagsuswell, no? So any swelling in any part of the body is also considered an emergency sign. And if there's persistent abdominal pain, like signs of surgery, signs that the child needs surgery. So tuloy-tuloy na abdominal pain, the child doesn't want you to touch his tummy. Okay, that might be appendicitis, no? No amount of DJs can uh, can stop that pain. Okay, so you need to bring your child to the doctor. So you need to know all those emergency signs so that you will be more empowered. So if you don't see naman those signs on your child, then maybe there's some window period that you can try to address it at home. Okay, especially it's very difficult to go now to the emergency room and go see your doctor because of the risk for COVID. And lastly, you love your doctors, no? The goal naman of medical professionals is really to help everyone, to advise you the best way they can. Okay. We have this dictum called first do no harm. So that's why some of my colleagues, you might have experienced this already, they're not recommending essential oils because even when I was back in medical school, when I hear essential oil, all I know is the essential oils in the mall, 'di ba? And that's not if you come to think of it, why will you use something that can be bought uh, in a mall that looks synthetic, and how can it be therapeutic? So that's the first um, notion of doctor. So kasi our dictum is first do no harm. But if you collaborate with them, you make them understand, you let them know what you're going through, and then your other doctors will really walk with you. Okay? We studied for at least a decade in medicine, but I believe that there's so much more greater knowledge besides science. Okay? 'Di ba? So just really need to communicate well with them. Okay, so I'm gonna keep this slide until the end of our class so that we don't forget. Okay, so we need to be reminded of all of these. Okay, all right. So we'll now start. Okay, the most common concerns that I'll talk about will be, of course, number one, fever, and then allergies, gut health, wound, and let's see if we still have time for the other concerns. But those are the most basic, most common concerns. Okay, so how I'll present it is I'll first discuss the cause, the most common causes of these kidney concerns, and how I approach these concerns with my own kids and with my patients. Okay, anytime that you have questions, feel free to ask or unmute yourself. Okay, or do we ask later na lang, Rachel?
Maybe after
All
after
right.
na lang.
Okay. Okay. All right. So first, ang pinaka kinatatakutan ng mga nanay. Kahit ako din noon, takot ako mag-fever, no? So fever, what's with fever that parents are very very scared about? Okay, so fever is commonly caused by an infection. An infection usually can either be viruses or bacteria. Most commonly viruses, okay? Why do we have fever if we have infection? Because all these organisms are foreign to the body, diba? So we have our own defense mechanism. So our body tries to fight off those infection. So in doing so, the body will produce substances to fight those organisms, okay? So these substances can elevate the temperature because, diba? Why do we sterilize? Why do we sterilize everything? Why do we heat everything, especially those our utensils, etc. Because the body knows that when it produces heat, it will help target all these microorganisms. It will help kill these microorganisms, kaya naglalagnat. So I actually posted about this in my clinic page before I was oiling pa eh. Is fever friend or foe? Okay? Because the common fear of parents is if our kids have fever, hala ka talaga, baka may matindi ng sakit or how can I help address this? Baka ma-admit yung baby ko, di ba? That's the common fear. But I hope I make you realize that it's a defense mechanism of the body. Okay? It's actually a blessing in disguise because it helps neutralize the toxins of the organisms. Okay? So actually if you'll be logical about it, if you drink more anti-fever medications, it won't have time for the body to have fever to mount a defense. So baka mas tumagal pa yung infection if you um, keep on drinking anti-fever medications. Unless of course your child has a history of seizure. Seizure kapag naglalagnat, no? So benign febrile convulsions. If your child has a history of that, or if the parents has a history of that, then it might be prudent to give anti-fever medications like round the clock to prevent seizure from happening. But if you don't have those history, I really don't advise giving left and right anti-fever medications. You know why? Because actually, paracetamol, it's a good medicine, but it's one of the most common medications that gets overdosed because it's being given like vitamins, okay? And of course, when I mentioned a while ago that you need to read trustworthy resources, commercials are not part of it, okay? Um, um, Excuse lang sa mga, if we have advertisers here, okay? Um, of course, those are sponsored, di ba? So you don't believe everything that's sponsored because it's one-sided. So paracetamol is really not for fever. Why? Because as I mentioned a while ago, fever is caused by an infection. Paracetamol is not antibiotics. It's not antiviral. It's not antibacterial. So it really won't kill the cause of your fever. What it does is it helps the child relieve of the pain, the body pains, the headache, like that lang, symptom relief. Okay, but it really will not target or will not the infection will not really subside if you keep on giving paracetamol. It might even get longer. I mean, it might get even worse because the body nga cannot heat itself eh. It cannot defend itself because the temperature is getting lower. Okay? So I really don't advise giving left and right paracetamol unless for those cases with children with convulsions when they have fever. And so I always tell my patients, the parents, don't worry too much. If for example you give paracetamol and then bumalik yung fever, that's expected because the usual duration of fever, especially if it's viral infection, mga 3 days talaga. So kahit even if you give paracetamol every hour, it will still keep coming back as long as the infection is there. Okay? So don't be afraid if your child's fever is not coming down with paracetamol because it's not really for that purpose. Okay? It's just for symptom relief. Okay? So what I do with my patients is I really try to work work inside out. Okay, so I ask them to, if they have essential oils, it's a big help because there's a lot of medical research specifically on lavender use to lower the skin temperature, especially because it also acts as an anti-infective. Okay, it goes through the blood and it helps neutralize the 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 microorganisms from inside. Okay, so what I do for my kids or my patients, it depends on the age. So for example, if it's newborn, you can use those very mild oils like lavender, frankincense, copaiba, and lemon. So don't use minty oils, especially for young babies. Okay, and don't use them pure. Okay, so use them diluted, always diluted. Okay, so for me, what I ask to do my patient on my patients. So lavender lemon, they make a blend, lavender lemon, copaiba. and put them on the soles of the feet, on the spine. Okay, so massage all over, and then frankincense diluted on the crown. Okay, so it's up to you how many times you want to do it. But me, what I advise them is like every 2 to 3 hours until the fever goes down, and adjust it accordingly. Okay, so there's for the new moms here, the new parents, the new oilers, don't be afraid. Don't follow really the strictly the dosing, like the frequency of applying the essential oils. Actually, the dilution also, you don't really need to follow it strictly, but it's good for you to know that for the very young ones, you need to dilute it more. Okay? For the bigger kids, you can use the more hot oils like thieves, but always diluted also, or peppermint. I also ask my parents to, the parents of my patients, to put essential oil in their sponge bath. So you put lavender, lemon, copaiba, anything that's not that's not minty, because the essential oils tend to have a stronger effect when you mix it with water, right? So when you do sponge bath, you put lavender, and it can really help. You can also do Epsom soak. So if you have bathtub, or kami dito, we don't have bathtub, so we use mega box. So we put Epsom salt there, and water, and lavender or lemon or frankincense. So they do babad, because what Epsom salt does is it relaxes the muscles, diba? Because the high magnesium content of Epsom salt relaxes the muscles. When you have fever, your muscle tends to straighten up. It tends to stiffen, kaya din may mga body pain. So it really is very helpful in relieving naturally the body pains of our kids when they have fever. Okay? Also, when we have fever, napapansin nyo, the lips of our kids get dry, di ba? They wee-wee less because it's dehydrating. Fever can dehydrate the body because of the heat, the body heat, so the fluids evaporate. So fever can really cause dehydration. So what I advise is you hydrate, of course, your kids, but this is the one of the favorite advices that I give. You don't hydrate them with plain water. You know why? They will just feel more weak if you give them pure water na madami. Okay? Because our kids, they're not little adults. Most of their chemical composition, their body composition is different from adults. So kids, especially the newborns, the young babies, they have more water actually. They have more water than adults. So if you give them more water, the remaining electrolytes in their body, their salts, their potassium, it will just get diluted further. So they will feel more weak. They will feel less hungry. No, so you don't hydrate with pure water. What's good to use is hydrate them with something that has electrolytes. Ningxia will be very good. Vitality drops on the water will be very, very good. Have you tried that? Super sarap. Yung lavender, siguro maybe for kids, the lavender lemon, kasi it has lavender. So it's really, and it has natural sugars in it. So ang fear din naman kasi with fever, on top of it being uh, causing dehydration, is that they don't want to eat, 'di ba? So they can get their sugar might get lower. Okay, so yung Vitality Drops has a good amount of stevia in it. It's super, ako, I really personally love it. So you put it in their water, and that you use that to hydrate your kids, and it will be better for them. So you try Vitality Drops. You can even mix it with Ningxia, but those two are the good fluids to use. Okay, don't give Gatorade or mga Pocari Sweat or any of those synthetic na you can just buy anywhere, because they have synthetic chemicals and the sugar content is not natural. So I won't advise that actually. Okay? All right. So if you're what I do with my patients who have fever, I try to wait for mga, if there's no emergency sign, I try to wait for around 2 or 3 days and decide if we are gonna do a blood test or a urinalysis. Okay, so it depends. It's a case to case basis. But I think it's enough for you to know that fever should not be really something that you fear. Okay? Because some of the patients we had before, those with severe immunodeficiency problems, like super baba ng mga immune system, like those with severe leukemia, they cannot even mount a fever kahit ang taas-taas na ng infection sa blood because their body cannot fight off the infection. So it's actually something that's good because it means that your body is still able to fight off that infection. Your body is still uh, your body has a good immune system that it's able to defend itself from the terrorist attack of the microorganisms. Okay. Also, another question that I usually get, and parents are mostly concerned also, is that Doc, paggabi mas lalong naglalagnat. No, so don't be scared. It's a natural thing. Even if even everyone, all human beings, even if we don't have illnesses, our temperature tends to go up in the afternoon or at night because it's the rhythm of the body. Okay, so all the more if you have ongoing infection, all the more that all the more that your temperature will go higher up in the afternoon, late afternoon or at night. So I'd suggest that you um, use your oils more frequently during this time of the day because you'd expect that the temperature will soar higher during these times. Okay? For paracetamol, it's really up to you how you want to give it. But me personally, my kids don't take it because hindi sila sanay uminom, so they really don't take anything else. Okay, but for those who are giving paracetamol, it's totally okay. Just keep in mind that you manage your expectations. Even if you give it, you can still have fever, and you don't give it round the clock unless you really have a condition that can cause seizure if there's prolonged fever. Okay, so that's so far that's for fever. Any questions? Or let's proceed. Later na lang ulit yung mga questions. Okay. So that's for fever. Now we'll go to allergies. Actually, allergy is a very, very 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 broad topic. Okay, so I'll try my best to give a brief overview about allergies. Okay, so allergy is an umbrella term that describes a condition that causes a reaction to a food, medicine, or substance.
Did she get cut off? Oh, okay, I think she's the one who got cut off. So let's wait for her to come back. Okay. Uh, so, yep. Oils for fever, lemon, lavender, copaiba, frank, crown of head diluted. So for those of you who are new, try to get a copy of Gentle Babies as well. That one is nice. Yeah. Let's see. Ayan, she's back. Okay, she's back. Nakamute pa kayo. You're still muted, Doc. Wait. There.
Okay, thank you.
And
Okay, so my internet really is here in the province is Crazy. Okay. All right. So, all right. Where was I? Allergy. So it's multifactorial. So top on the list for the causes of allergy is genetic. So if your family member, any of your family member has a history, so there's a big chance that you can transfer that to your child. Okay, so that's genetic. Number two is exposure to the environment. Okay, so even if you don't have a family history or genetic preponderance to allergy, you can have allergy. Your child can have allergy depending on the load of environmental allergens they're exposed to. So it can be from dust mite, that's usually number one, dust mite, or very strong chemicals like from your house paint or your the bath and body products that you use, from the cleansers that you use, any strong any strong substance that's synthetic can cause allergy regardless if you have a genetic preponderance. So it will just be more severe if you have a family history. Okay. And another thing, a new more and more research is geared towards gut health as being the cause of one of the causes of allergy. So gut health meaning if your body is exposed to a lot of bad bacteria. So if your good bacteria in your body is overpowered by the bad ones, then you can have potential for allergy. So what are the situations wherein your body can have more of the bad bacteria than the good ones? Number one, if your child is born by a cesarean section. So most of the time, actually, when I was still having pre-COVID, when I have my clinic pa, so whenever I see a patient that has very, very severe allergies, I mean skin asthma, it's almost automatic that that baby is born cesarean section. Okay, you know why? Because um, God naturally um, made us to be born vaginally. Okay, that's the natural way. So any disruption of the natural process can let you be more prone to predominance of bad bacteria. So the vaginal canal is full of good bacteria. So when the baby passes through there, they even ingest vaginal fluids. That's also good for that's also full with good bacteria that lines up the throat, the gut, the whole of the gut. No, so those babies have a less tendency to allergies because early on they're coated with good bacteria that's good in fighting allergies and constipation and other chronic illnesses versus a baby that was stressed, most likely, 'di ba? Madalas ngayon emergency cesarean section. So the baby inside is stressed. Later on I'll tell you more about um stress in the brain that can also cause allergy. So the baby is stressed, and then she was delivered by a cesarean section. There's also good bacteria on the skin, but it's not enough to fight off chronic illnesses like asthma, allergy, or constipation. Okay, so they're more prone to allergies and severe ones if they are born by a cesarean section. So that's one of the researches are geared towards nowadays towards gut health. Okay, actually there is a starting research, like for example, when a mom is scheduled for cesarean section, they will place a gauze inside the vaginal canal before the baby comes out. And so when the baby comes out, that gauze is removed, and then they apply it all over the body of the baby, parang to simulate that it passed through the vaginal canal and was exposed to all the good bacteria. But that's not yet being done in hospitals. That's not yet a guideline. Okay, but some doctors are doing that already. Okay, to help build a good foundation for the baby early on, so that they're exposed to good bacteria. Okay, and what else? So being breastfed is also very, very good way to prevent allergies and constipation, because it brings about it really um, brings about the good bacteria in our body. Also, if you are
exposed to left and right antibiotics, that's not good for you. So it's gonna kill all your good bacteria that helps fight off the bad ones. So if you are exposed to all these antibiotics unnecessarily and you don't follow the recommendation and dosing of your doctors, it will really cause um, the bad bacteria to predominate in your body. And all of those can lead to severe allergies. Okay. So, what else do I do? So let's start from the skin. Okay. Skin and then allergic rhinitis and the lung asthma. So for the skin, um, I think most of our parents here are aware of the the kind of rash for skin asthma. So usually it's on the face. No, it spares the side of the nose and around the mouth. So it looks very red, very itchy. It keeps on coming back, no? But I'm telling you, no matter what you put on the skin, if you don't really target the inside, you will not have a sustainable desired effect of from that allergy. No, so you really need on top of your topicals, you really need to heal the gut. So most of the time, I give probiotics to my patients and advise early morning sunshine because vitamin D is a very, very good vitamin to help prevent also allergies. No, it's often dismissed, but more and more researches now are also gearing towards the use of vitamin D to prevent all those chronic infections. So vitamin D, and it also improves the immune system. No? So it's all good for allergy. So what I use for the skin, it's really it really depends on your child, no, on the preference of the skin of your child. If it's very very on the very very young population, you can use lavender or copaiba. Anything red, copaiba can is the top of it's always on the top of my mind. Copaiba, if there's anything red, it means it's inflamed, no? So copaiba, lavender, but try to also gauge, of course it's diluted, diba? Try to also gauge if it will work better with coconut oil or sunflower oil. From dermatologists, they're saying that sunflower oil is better for those with skin asthma. But again, it depends on your child. So you really need to be observant. Okay, frankincense. Never use it undiluted on babies because it can sting. Okay, so you really need to dilute it very very well. Okay, so actually why I started oiling is because of my eldest child's severe eczema. Okay, sobrang lala ng eczema niya. We've been to different we had different checkups already. She had a lot of allergy testings already. So I was already a doctor then, but I was so frustrated. I was so disappointed because despite of all the topical ointments that we put on her, because that's the prescription for us. No matter how much I strictly apply all those topicals, it will still come back. Okay, that's the time that when I started to research on the benefits of natural products. So that's when I started this natural lifestyle. So actually, I started about 10 years ago pa. But with YL, I just started September 2017 eh. Okay, so really using natural products is really one of the key towards achieving symptom-free eczema. Okay, and of course, healing the gut. No, so you breastfeed more when your child is eating already. You give them more fresh food. Avoid giving preserved, yung mga um, uh, ready to eat na mga cereals, 'di ba? So those will not be good for them, especially if they're born by a cesarean section. They will be more prone for allergies if you do all those. Okay? So what else? I also do oatmeal soak. Actually, even before Aveeno released their oatmeal bath, I've been doing it already. Eh. So you blend oatmeal. I think any oatmeal will do, but the slow cook ones will be the best ones to use, of course. So you blend them until they're powder form. So parang ang consistency niya parang sand, very fine sand. And then I put that in their soak, in their bath. And then I put lavender oil on the soak. Tapos you just babad, no? Apply on the face or anywhere that's there's itch, no? So it's a um natural way to soothe the irritation, the itchiness of your baby. Especially if your babies are small pa, they can fit pa sa ano to, what do you call this? Sa bathtub, in their small bathtubs, that would be very, very good for them. But it's just very slippery, so that's the caution there. Okay, so oatmeal soak, you use your, maybe it's best to use sunflower oil, diluted lavender, copaiba, okay? And you add probiotics also. Um, Young Living has a very nice probiotic line, but kasi the Mighty Pro, it has wolfberry. So it has a taste. So I don't advise it to very young kids, very young babies, especially those who are not yet eating, because they might disrupt the taste buds. Okay, so if your baby is very small pa, it's best to use probiotics that doesn't have any taste. Okay, but Mighty Pro is very good for those bigger kids. Okay, and then vitamin D drops. I hope YL will soon release vitamin D drops, because there's just a few brands that you can find with vitamin D drops. So you can find it online. So that's a good way to relieve also all the allergies of your baby. Especially mahirap magpaaraw ngayon kasi it's risky going out. So um, I see a lot of allergies actually recently, because the kids are just in the house. They're not getting enough vitamin D. So vitamin D3 is actually good for everyone, no? But for babies, use the drops. All right. So what about allergic rhinitis or lung asthma, no? So similar causes as with skin asthma, but it can be more difficult to manage because allergies doesn't really have a cure. You can only control them. And important here is that if your doctor already prescribed you something for your allergic rhinitis or for your asthma, please follow it, okay? And support it with oil. So eventually, the goal would be to lower the dose of that medication, but of course you should not be the one to discontinue that medication. Okay, the essential oils are here to support us. You do not stop your maintenance medications for lung asthma or allergic rhinitis just because you're oiling. The goal is really to lower the dose and then go back to your doctor. Doc, okay na, hindi na wala nang we don't experience any symptoms every week, wala na talaga, and that's the time that your doctor can stop the medication and you continue your what's working for you. Okay, all right. So for lung asthma and allergic rhinitis, it's really it's really a challenge because there's a lot of environmental allergens. So with
Okay, so we got cut off again, so we better wait. Yeah, so her internet connection is not as fast as in Manila. We just have to be patient and wait for her to get back. Okay. She's back.
Okay, hello.
Yeah, she's back.
All right. Okay. All right. So going back to allergies, so how can you control the triggers of your allergies, specifically allergic rhinitis or your lung asthma, even skin asthma, okay? So you always clean your mattresses, your couches, but ito from personal experience and from experiences of my own patients, this is working so far, no? So your mattresses, your couch, you don't pagpag them. Ano ba may English ba yung pagpag? Basta you don't tap them to, 'di ba? Lalo na our lolos and lolas pag naglilinis, pinapagpag yung couch, yung mattress. Don't do that ever because all the more the dust mites will go up to the air. Okay? Hello?
Yes.
Hello?
Yes, we can hear you. Oh,
Okay.
okay.
All right.
Nag-freeze
I
ulit.
thought I was lost again.
Parang
Okay,
you're
so-
frozen though.
All the more that the dust
Okay, lost you. Lost her again. Oh no. So for
Okay.
carrier oils, I use V6 in case. Oh, yan. Sige, she's back.
Yeah, V6 is very good and it's free. It's free for the July ER, no. V6 is very good also. Okay? So all right, going back. So don't pagpag your couch, your mattresses, your throw pillows because the dust mites will just really fly off the air and if someone is very sensitive in your house, specifically your kids, no, they will inhale it and when they inhale the allergen, it will do something in the airway and in your lungs that can really trigger your asthma and your allergic rhinitis, no? So ang nangyayari inside the airway is similar to what's happening on your skin, 'di ba? So for example, if you get an insect bite, it will get red and then it will swell and then later on it's gonna have liquid na, may secretions na, 'di ba? That same thing is happening inside the throat, in the airways. No, when you inhale an allergen and you're sensitive to it, it will cause redness, inflammation, your tissues and your cells will swell up and then later on magtutubig na yan. So hence you have nasal secretions and mamaya you're coughing na because of all these. So I don't advise making pagpag. So best way really is to vacuum
Okay. She got cut off again. Yes, so V6 is available in the Philippines, but this month it's currently out of stock, but you can get it for free on ER. Yeah, she's back.
Hi, sorry, I don't know why I keep on getting disconnected. Okay, so unless you have a HEPA filter vacuum, so that vacuum is, I think, around 250,000 pesos. That's the only vacuum you can use, no? Yung mga hospital grade vacuum. Don't use the regular vacuum because I did that before. So I was, I I realized they just brought up the dust mite from under, so it became more it reached the surface more, so it gets more itchy. So I don't advise using regular vacuum. Instead, I iron our actual bed, the mattress, the actual pillow, not just the linens or just the pillowcase. So I iron it. Oh, but before I iron, I make a linen spray. It has Thieves Household Cleanser. It has eucalyptus, lots of eucalyptus and lemon. I think basta important is there's eucalyptus in it and Thieves Household Cleanser. And then I mix it with either witch hazel or vodka or gin, whatever's available with little water. That's my linen spray. I spray it before I iron, so that I observed that when I add eucalyptus to the linen spray, it it feels so much better. The bed feels so much better, and my kids tends to get less bites from the dust mite, no? So the dust mite bites actually look like an insect bite, like a mosquito bite. But magtataka ka kasi nandun sa mga even dun sa mga places inside their dun sa mga or body parts that are covered naman with clothing. So it means that that's dust mite, no? So eucalyptus is very good for dust mite. Just be very cautious if your child has, say for example, epilepsy or a seizure. Um, maybe use eucalyptus when she's out of the room. You let it dissipate first because eucalyptus has for her. I'm not saying it will trigger, but you closely observe, it might trigger an epilepsy. And maybe use the radiata variety because it has lesser camphor than globulus and eucalyptus blue. Okay, so you do a eucalyptus linen spray and then you iron it well. And I observe that when you do that at least every week, less allergic symptoms, less skin asthma will occur. Okay, and then if you we believe, diba? Do you believe in energy? Everything has energy, diba? Our body has energy. Even non-living things they have energy also. So the lungs, they have a specific timing of energy where there's a certain time of the day where our organs have their highest energy. So the lungs, the highest energy of the lungs is between 1 a.m. and 3 a.m. This is just my personal observation. When I try to diffuse during that time, they I sleep. I have allergic rhinitis. Okay, I sleep better because the lungs has the greatest energy during those times. No, so if you can, if those who are not yet asleep by 1 a.m., so that's the best time in my personal experience to use your oils or to apply oils on your kids. Okay, between 1 to 3 in the morning. I read that here. This is a very good book, Ultimate Balance, by Leanne Deardoff. So this is a very nice book. So it incorporates the different time energies of the organs, the musical notes that you can use to improve all your bodily concerns. Okay, and then when it comes to asthma, actually it depends on what will work best for you. But so far, frankincense will be very good. Copaiba. I try to avoid minty oils if my patients have asthma. Frankincense, why? Because it has a chemical component that's similar with steroids. Okay, so diba, the mainstream medication for asthma, especially those who are um, having symptoms very frequently, is steroids already. Okay, and but doctors, of course, anyone knows, even doctors, we know that we cannot give steroids for a long time. It needs to be tapered, okay, because of the potential side effects. So frankincense, according to one of the researches I read, it has a component similar to steroids, so we can maximize frankincense because of that. Okay, but again, if you're just starting, don't put a lot of frankincense in your diffuser, or don't apply too much frankincense in your body. Just you start low and slow and then build up from there. If you think that you don't have um any any unwanted side effects from from your regimen, your blend. Okay, copaiba is also very good because it's very good for inflammation. Okay, and it's very, those two, lavender, those two, frankincense and copaiba, you can also add lavender. They're very mild, and it will not cause irritation in the lungs. Okay, so I read also that sometimes in some patients or some kids, it's more justifiable to apply it first rather than diffusing. Okay, make your cells adjust to the oils first, especially if you're just starting. Okay, and then what else for asthma? Oh, my eldest child, she has asthma, but she outgrown it already, no. But if the coughing is very dry, you can try Digize. I never thought I would diffuse Digize until that time when my kid was coughing so badly. It was very, very dry. And parang hirap na talaga. No? So, I applied diluted digice on the chest and the back, and I diffused it. Oh my goodness. I never realized I will ever diffuse digice, but it worked. It really worked. So, um, she fell asleep really, really well after that. So you can try that also. But again, the jice can be a hot oil, so dilute it very well, especially if you're just starting. Okay, all right. What else for asthma? Okay, so yeah, so basically for all asthma issues, whether skin, in the nose, or in the lungs, very important is you keep the good bacteria at the high level in your body. And also you try to avoid environmental triggers. Okay. All right. Okay. So that's it for allergies. For the gut is also a very, very large topic, but we'll try to I'll just try to share with you the most common concerns with the gut. Okay. So the gut is actually related to the brain. That's the new research now. No, the brain gut disconnect. Okay. So they found out that gut symptoms, whether be it diarrhea or constipation or reflux, is not really entirely due to an organic cause in the gut. Organic meaning usually it's not because of something that's in the gut. Usually it's just a side effect of what's happening in your brain. Okay, so your brain and your gut, they're very connected. They talk to each other. So, di ba, for example, when you're having an exam or when you'll have a class, di ba, sometimes parang you feel that you want to to pass tools. Parang you don't know if you're feeling constipated or if you'll feel like you're having diarrhea, no? Kasi the brain is getting stressed, no? It's getting nervous, and if the brain is stressed, your gut is also stressed. And stress in the gut can manifest in so many ways. It can even manifest on the skin. Okay, so that's why when I told you a while ago that true healing should be balanced, it should be holistic. Because if you just treat just the superficial concern, if you don't target the insides, if you don't look for ways to heal the root cause of the problem, it will just keep on coming back. So gut issues really need to be simultaneous with healing of the mind issues. No, so you really need to relax your mind. So aromatherapy is really very, very helpful when it comes to gut issues, no, to constipation, to diarrhea, to reflux, anything about the gut. So aromatherapy will really play a role because usually it's just a stressed mind that causes a weak gut. Okay. So for constipation, let's start with constipation. If if your child is born by a cesarean section, it's also gonna cause more problems. Okay, because there's an imbalance between the good and the bad bacteria. So what you can use digice, yeah, diluted digice. You apply it clockwise. You add you if your baby is still very small, hope you're still breastfeeding. Breast milk is very, very good for digestion, and it will prevent constipation. If your child is already big, you can start. I read from a research from a fellow mom who's a molecular biologist in Harvard. She made a recipe book. I forgot her name, but she's of Indian descent. So she said that from her research, adding pure powdered turmeric or white pepper or saffron to your child's first food will be very, very helpful to her gut, especially if your child is born by a cesarean section, because it helps improves the good bacteria in your gut, and it releases the anxiety from the mind, from the brain. Okay, so turmeric is very good to add in your child's solid feeds. It will not make it spicy, kasi it's just a dash of powdered turmeric, and ang bawal lang naman with babies is sugar and salt, but those healthy spices would be very good for them. Okay, what else? If your child is bigger, so you add more fiber to their diet. Okay, the regular medication that we give for babies, for kids who are having constipation, is lactulose. Lactulose is a form of sugar. It's a synthetic sugar. The purpose of it is if you load the body with sugar, talagang maglulusen yung stool. So I seldom give it. Okay, so what I usually do is just really fix the diet and then digest and then diffuse calming oils. And it also it can be sometimes very tedious to do consultations for constipation because it involves behavioral management. So maybe we can do that in another class. Okay, but it's important also that you do all those and do massage during the time of the gut's highest energy. So the gut's highest energy is early morning. Kaya 'di ba? Most of us we pass stools, we do our bowels every morning because the highest energy of the gut is early morning. So it's best that if you have constipated child, you apply the oils on the tummy, on the reflex points, on the soles, early morning. Okay, so it might help the organ more to excrete all those unwanted wastes from the body. Okay, what else? Ningxia is very good for constipation. Um, after my first child, I had cesarean section. I noticed that I'm not moving my bowels as often as I wanted to. No, so Nix really helped me. So with kids, the lowest, the earliest age that you can give Ningxia is maybe um 10 months old. Yeah, you can try that already. As long as they're starting to eat na foods with different flavors, that's okay. Now we don't want to give it earlier because they might get used to flavored food. So by 10 months usually varied na yung so they're exposed to different flavors. So you can add a few teaspoons of Ningxia to their food, especially if they're having constipation. Okay, so for diarrhea, I think it's the same also. It's digest also and apply it on the soles because for diarrhea naman, it means your child ingested some virus and it's the body is just trying to rid it off diarrhea, but sometimes it can cause dehydration. Okay, so you can give Ningxia or the vitality drops, as I mentioned a while ago, underwater would be very good. Okay, because the regular electrolyte solutions that we have, they're very good. Their concentration is very good, but they're not kid friendly. Okay, hindi siya masarap. So I'd rather give something na I know that the child will drink to prevent lowering of sugar, to prevent electrolyte imbalance, than something that they will just vomit out. Okay, so for reflux, I haven't seen any kid with reflux nowadays, but if your child, or especially if your child is already a teenager or a bigger kid na, if your child is having recurrent coughing episodes and you tried everything na but it still won't go away, it might be reflux. Okay, because especially if your kid is being overfed, or even even the young ones, if you overfeed them, especially if with you overfeed with formula milk, which is very difficult to digest, it will just regurgitate. It will just go back up the esophagus. Of course, when it goes back up the esophagus, it has acid already. Your airway can get irritated. Okay? And so you'll have coughing symptoms. So I think I had one patient before, parang, I think she was 3 months old, keeps on sneezing, keeps on coughing. We tried everything, but nothing seems to work. And then I realized that that the baby's being given a lot of milk. Okay? So every time daw na umiyak, parang bigay sila ng bigay ng milk. And that's not good. So for moms here who are giving bottle feeding, so just make sure you try to stick to the recommendation in your milk, no, because if you go beyond it,
No, actually, even if you don't go beyond it, formula milk is very allergenic and it can really cause other symptoms. Just be very careful because you can have prolonged coughing symptoms and parang allergy-like symptoms if you continuously give those kinds of supplements to your child. So the earliest that you can wean, the better. So you can start solid feedings with healthy food. No, so to avoid all those symptoms of reflux. Okay, with reflux also the Jice is very good. Just a caution also, no, it has fennel kasi the Jice has fennel, so it might also trigger. Fennel is one of the essential oils also that might trigger mga seizure, but not everyone, okay? And it's diluted naman so there's less likely there would be any chance. But for those who have kids who are really epileptic, you might want to observe the Jice very well first before really applying it every day on your kid. All right. So what else? So that's it for the gut. One more thing, Life9 is very good, so I take it also. So even my kids, my eldest child is always constipated. So even if it's for adult, what I do with her, because she cannot swallow yet the capsule, I put it directly and I open the capsule directly in her mouth. So I let her gargle it and then swallow. So you can use that also to your kids' Life9. Even if they can't, swallow yet the capsule. And then what I do, the capsules, the empty capsules, I keep them for later. So when I put their other essential oils, di ba, tipe, di na ka mag-order ng vegetable capsule. So two birds in one. All right. So what else? So we did fever, allergies, gut. And then now I'm seeing a lot of patients with swelling from wounds, no? Because nga the kids are not going out, they're not getting exposed to some little bad bacteria to exercise their immune system. They're always inside, hindi naaarawan. So those really are the perfect recipe for infection of the wounds or mga pigsapig those recently. So what can you do with it? So you can apply, of course, my forever favorite, Copaiba. Kasi very mild, diba? It doesn't sting, but it's very, very effective for wounds. Actually, I don't know any medication, any pharmaceutical medication that can do what Copaiba does. No? Yung ilagay mo lang, after a while, subside na agad yung swelling. So it's very, 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 very good for all things that are swollen in your body. Okay, and it's very kid-friendly too because it doesn't sting, it doesn't burn, right? So it's very good. I even recommend it sometimes to my teething patients, to my teething babies. No, we apply it here, so outside of the lower lip, no, and it really helps controlling the gum inflammation. Okay, so for wounds, you apply Copaiba. If it's really swollen, sometimes if there's potential for pus or boil, you put warm compress to get out the boil, and then you can put purification or thieves. Actually, thieves can be very spicy lang, but it really can dry up those kinds of wounds very, very fast. For open wounds, of course, my top favorite, Helichrysum Forever. Diba? So it's very mild also, and it doesn't sting, it doesn't burn. You can apply it actually pure even on the wounds, no? And it will really close. I was supposed to do a class in my group, but hindi ko na natapos, no? So I was really very, very curious why Helichrysum does what it does, no? Kasi it really can close up wounds in a few seconds, right? Super galing, no? Para siyang magic talaga, para siyang glue na nakaka-glue agad, no? So what I found out was it has a chemical component that only Helichrysum italicum, italicum is the one that YL distills, diba? It's the only plant that has that certain chemical that can close up wounds that fast. So even other Helichrysum varieties doesn't have that
chemical component. Okay? Kaya helichrysum is very, very nice for wound healing. And you actually don't need to me personally I don't put betadine on open wounds. That's not medically that's not allowed also, because the iodine component from the betadine can go inside the circulation if you put betadine on open wounds. So I'd rather put essential oils than putting betadine. It's very, very soothing also. No, so it's multi-purpose if you put essential oils on your children's wounds. But of course, you collaborate with your doctor, because if it's really swollen, especially on the face part, you might need more medications, not on top of the essential oils, to prevent you from getting admitted. Okay, that's the goal nowadays. Prevent your kids from admission because of all the risk of COVID. Okay, so far, in all of my patients, actually, for the most common kidney concerns, doing a holistic approach is really doable. I haven't had any patient now na na-admit so far, ha? So, really collaboration with your pediatrician is really key to everything. You 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 help also your pediatrician, you empower your doctors also, so that they can walk with you through life. Okay, all right. Another thing before I forget about wounds, especially if there's yung mga boils or pigsano, it happens when the sugar in your body is getting high. Okay, so kaya I get a lot of patients with these skin issues nowadays, because naiiwan sa bahay. So they sugary stuff. So the balance in the body gets problematic. So lowering the sugar intake of your child, if you have those concerns, will really help your essential oils, or even if you're taking medications, it will really help resolve everything. Okay, so it's really um, um, a um, harmonious collaboration between all the aspects of your life, so that you can really achieve a true balanced healing. Okay, so I think that's it. I think those are the most common concerns that I think would be very helpful for everyone. So maybe we can open the floor for questions.
Okay. Thank you, Doc. So I'm going to remind everyone to keep their questions on this topic. Anything complicated, we want to give you back to your doctors. Or you can, book a consultation with Doc Dale kasi that's her profession, di ba? Ano, respeto nila. So, let's go back and see. Gosh, ang haba. So I saw a question on the age-old controversy between using eucalyptus for younger children. What do you think about that?
So actually for me, I even use globulus no on my when I diffuse. My kids are 9, 8 and 4. So it's really up to the parent for you to observe your children, 'di ba? So we are the gatekeepers of our families. We control what comes in. You can really read or um uh listen to stories of your friends, or you can take advice from your doctor. But ultimately, it's really your decision. It's your decision what will you use, no? And how will you decide if you will not actually try? 'Di ba? So, but of course, when you try something that is not really so much indicated for that age group, you try it slowly. So the key is you try it slowly, and you be patient and be observant. Okay, so I don't think really there is uh, strict guideline on that. But actually ako nga personally, I use globulus more because I use less drops, because it's more potent than radiata. So it's cheaper. It's cheaper eventually kasi globulus is cheaper than radiata, and then I use less drops pa because it's more potent. So in the end, in the long run, you'll mas makakatipid ka actually if you use globulus. Just be more observant on your kids. And of course, I mentioned a while ago, it has higher camphor content. So if you have issues with epilepsy, although that's rare lang din naman, you might want to lower the dose or use radiata. So just be informed of the basics, and then you go from there and adjust.
Okay. I think we need a recap on your protocols for fever, just so that they can catch and put down the notes.
Okay. So for me, for fever, what I do, so this is what I'm using on my kids and what my patients are doing also. I'm a pediatrician, but I am not everyone's pediatrician. So always best to go back to your doctors and confirm. Okay. So for me, what I do for newborns, I use lavender first. If it seems to not work, then you start to add more oils. You can add frankincense or lemon or copaiba, but it's always nice if you have a newborn to start with single oil first and then dilute it very well. Okay, so you apply it on the spine, on the soles, side of the neck, and then your blend for the top of the crown. It's very helpful that you add frankincense because frankincense brings back oxygen in all the cells of your body. No, so what happens kasi when we have fever, our blood vessels constrict, so there's less oxygenation actually, in whole of the body, especially the brain. So it's the reason why we put frankincense on the crown. It's to help bring oxygen in that vital organ, especially when our child is having high grade fever. Okay, and for bigger kids, you can use the hotter oils like thieves, peppermint. It's really up to you, no? And what I do, I alternate my blends, 'di ba? So I don't use thieves all the time because ang ano diyan, ang explanation diyan, orange is good for you but you can't take naman orange every day, right? So you need variety, so that your immune system will also be very thankful for you because all the viruses, the bacteria, they tend to change their structure. They tend to adjust to what they're used to. So para lang malito yung mga viruses, you need to alternate your blends. Okay, so ako in my diffusers, I alternate thieves, lemon or eucalyptus, and then with oregano and orange. And usually yon, palitan lang sila. And ako, when I blend, I add single blends to those blended oils from their original blend. So for example, thieves. Usually I mix thieves with single oils from the thieves from the thieves itself. So I add either lemon or rosemary or eucalyptus. No, that's how I do my dilution. So for topical naman, of course, if you're gonna use the hot oils, you should dilute it very well. So actually, there's no hard and fast rule. There's no actual really protocol per child. My protocol might differ from yours, no. Ang importante, it's working for you, no. So we should not be very strict on what oils to use, what how many the frequency that uh we use it with, diba? So it's case to case basis. So for me, for bigger kids, thieves lemon, eucalyptus, or thieves lemon, rosemary, or if you really want something strong, will be very careful because it's very very hot. So dilute it very well, and then you alternate it. No, same body parts like the soles, the spine. Although I avoid using mga strong oils sa spine because it can be very hot. So I tend to use the strong oils more on the soles para it's thicker, so it's less skin sensitivities. And for the sponge bath, you add water and then lavender or lemon. For the soak, for the body soak, in a regular mega box, I put 1 cup of Epsom salt and then maybe at least three drops each of lavender, lemon, frankincense or copaiba. So that's for fever. For skin asthma, It depends on the age, but usually what's good is lavender, copaiba. Copaiba if there's swelling or if there's redness, add copaiba. If there's little itch, I usually add eucalyptus to address the itch. And frankincense also. What else? For allergic rhinitis, anything with frankincense or copaiba is also very good because it helps. Allergic rhinitis is something that's inflammatory, so those are very good oils to help with that issue, and they're not so strong, so it's less irritation on the cells of your lungs and on your nose. And for gut, of course, the is diluted. You can even add peppermint also if your kids are bigger. And Ningxia, very, very important for the gut. For wounds, lavender, copaiba, frankincense, helichrysum would be very, very good. So with the dilution, the number of oil drops, there's no strict rules. You start slow. You use half dilution if you're starting, and use it. Don't use it as frequent if you are just starting. And then eventually, when you're used to it, build up from there. Okay. There's no really, I don't think there's overdose in topical application. Okay. As long as your body or your children are happy with it, you're not seeing any side effect, then that's okay.
Okay, thank you. So I have a nice question here. How do you empower your doctors who is against the use of essential oils or natural meats? So we have a lot of those who are not yet
Yeah.
open-minded.
So,
So
yeah, actually they're not against naman, no? Because our dictum is to do first do no harm. And the essential oils that we know are those synthetic ones, 'di ba? So talagang naman yung mga synthetic essential oils are very, very harmful. And we were not um the medical curriculum here in the Philippines is not does not cover all of those natural therapies, even breastfeeding nga eh. I only learned about breastfeeding when I became a mom. So it's not actually tackled well in the medical curriculum. And of course, my residency program kasi has a very good breastfeeding curriculum. So that's how I learned also. But in the US, I think more and more medical schools are incorporating complementary medicine to their curriculum. So they would be more open for that. So it depends actually on your doctor. First, it's really you build their trust, you build trust on each other, you be more open, or you be more proactive, you be more stimulating. Hindi pwede yung oo ka lang ng oo, di ba? Nowadays, we should be more proactive. We should read more. If you do not read more, how can you stimulate your doctor, di ba? So, before you talk with your with your medical professional, you should actually be more equipped, 'di ba? So how can you be equipped? How can you be more equipped? So you read. You read from trustworthy sources, you read from the groups, 'di ba? Kasi there's a lot of posts in our groups that are very trustworthy, 'di ba? And from ano yan eh, from personal experience, 'di ba? So the first step really is to educate yourself. Educate yourself with the proper information, and then build trust and communicate well with your doctors. That's the first step eh. Kasi if you just go to your doctor and then you tell your doctor na, doc, I'm using this and this and this. Why are you using it? Just because I want to. Hindi pwedeng ganon, 'di ba? So your doctor needs valid evidence. Of course, kasi we're taught that way to believe in scientific evidence. There's a lot of medical evidences, no? I as I mentioned in the class before, you can actually print out medical references if you need to, 'di ba? Para you're ready. The key is to be ready. But actually are more open-minded, no? So, when you tell them na, doc, this makes my child go to sleep better, you can try it also, especially if that doctor has a family of her own. Then it's much easier for them to try it on, because first and foremost, before we are doctors, we are parents, 'di ba? That's our primary role as parents, not as doctors. So it's easier actually to encourage those doctors who are
What's wrong with your
parents.
doctor?
Yes, 'di ba? So know your doctor, 'di ba? Know your doctor. Know your oils, be prepared, know your doctor para you can communicate with them well so they can walk with you through this journey, 'di ba? That's the best actually. That's the best um form of healing. You collaborate complementary to Western medicine because that's really the best way. Actually, when I was browsing for this class, I went back to my pediatric book, the book that we use for our boards. May portion pala doon on complementary medicine. Ngayon ko lang nabasa, ano ba yan? So meron nga doon nakalagay lavender for aromatherapy is a mild sedative. No, so 'di ba ako, I read a lot, but it's the first time I saw it in our book. So you just really have to um uh empower din your doctors na but you see it in a nice way, di ba? Parang, Doc, parang balita ko meron sa libro niyo na ganito, ganyan, na complementary medicine, na you use lavender and they acknowledge the benefits of essential oils, di ba? So sometimes it just takes a little a little push, no? But of course you do it in a nice way. So important na you build a harmonious relationship with them so that that trust is there.
Can you repeat your protocol kanina on the turmeric? Because we have a question here on eczema for young babies, like 6 months old. Yeah, so parang you mentioned
Okay.
food and how to get that bacteria back.
Yeah, okay. So especially if your baby is born cesarean section, she will be very, very prone to allergy, no? Um, that research was I know na, I remember Dr. Ken Koya from Harvard, no? He's a molecular biologist. Ang website niya spicespicebaby.com. Spicespicebaby.com. So you can put a dash of pure, basta make sure lang na it's pure, ha, because I actually don't buy from the grocery. I don't use the Maxi brand because I'm not sure if that's pure. You get from a reputable source, no, of pure powder turmeric. Even doon sa mga the turmeric tea, because that's blended already. Excuse me. So you use the pure powdered one. You put a dash on your child's solid feedings because it won't really taste a lot. It won't alter the taste actually. So you do it maybe you start first with once a day, then gradually um, elevate it to 3 times a day or to every time your child eats. No, it does a lot of good in the good bacteria in your child's gut, and it releases the anxiety from the mind. So it targets both organs. That's the usual root cause of skin allergy, which is the mind and the gut.
Another question here is for very, very young babies, like newborns, is there caution on the diffusing? Or should we do topical first? Or should we do intermittent? What is your recommendation?
So for starters, you always use low and slow. So for example, you have the dose of the recommended in the diffusing guidelines. Diba, in the diffusing guidelines, just 30 minutes at a time. But so if you're starting, maybe just do it 15 minutes muna, no? And then you use less drops. And then I prefer to use mild oils first. Like for example, I mix lavender and copaiba or frankincense, and then and go up from there, adjust from there. I don't usually um uh diffuse mga minty oils muna for newborns. But if they're used already to diffusing, then you can try Eucalyptus radiata or 1 drop of Eucalyptus globulus. I think you should start first from eucalyptus because it's milder than peppermint. But again, I don't think that's the best way to start your diffusing journey, no? So you use muna the miles. For topical, also those four, no? Lavender, lemon, copaiba, and frankincense. But use single oils first and then build up from there.
So for those who jumped in late, we did talk about asthma and others. So just go ahead and do the replay and list things down. So some of the questions here have already been answered earlier. Um, oh, how about rose ointment? Can kids use that?
Yeah. Actually, even newborns can use that. My issue lang with rose ointment is I find it quite hard. So I dilute it pa. So I separate I half the tub. I remove the half from the rose ointment tub, and then I melt it a bit, and then I add coconut oil or sunflower oil to make it more. That's my personal take lang ha, kasi I find it hard to apply. So I make it
Sure.
more spreadable. So I melt it a bit, and then I add more carrier oil para it's more spreadable. But yeah, you can even use it on newborns. It's very very mild, and it's not petroleum based, so that's the most important thing. You try to avoid, oh sorry, I forgot to mention, dun sa may mga gut issues like mga colic, we don't advise putting manzanilla na ha on kids, on babies, okay, because it's mineral oil based, and the skin of our babies are porous, so that synthetic substance can go inside the bodies of our babies, so we don't advise any product that's mineral or petroleum based. So petroleum based like petroleum jelly, don't use that anymore. Yung mga manzanilla, no, I don't really like those products, especially for newborns.
For people who are breastfeeding, are there oils that they should avoid?
Actually, I don't believe that you avoid. There's no absolute contraindication naman with using oils, and whether you're pregnant or you're breastfeeding, it just depends on how you react to it. With peppermint kasi, that's why they don't really advise that, is because of its indirect effect, di ba? Peppermint, ako when I inhale peppermint my appetite gets curbed eh. So, 'di ba, when you're breastfeeding, you need to have a sustainable nutrition, 'di ba? You need to drink a lot, you need to eat, you eat frequently, 'di ba? And you won't be able to do that if the effect of peppermint on you is to curb your appetite. So it's an indirect effect. So you'll have less fluid intake. So kaya baka bumaba yung milk supply mo, but I don't think there's a direct effect to it. So it's really up to you. You really need to listen to your body. You try it little by little, and if you think there's no effect on you, then good for you, because peppermint is my favorite. I like it on my coffee, on my hot chocolate. I like it on everything. So, but if you notice that your milk supply is dwindling, then it's just it's due diligence for you to lower your peppermint inhalation, or lower your dosing in your, if you're adding it to your drinks, no. So it really it's a case to case basis. So but there's no absolute contraindication, okay, on any oils for that matter.
Um, for since we can't use manzanilla, what can we use instead?
Dijais. But dilute it very well kasi it's like a spicy oil, an herby oil. So I'd suggest, for example, if you have a newborn, I don't like na nga roller bottles eh. So best to use is a pump, a glass pump. So for example, your pump is like 30 ml. So just add maybe 3 drops of Dijais, and you see if it's gonna have an effect, and then you build up from there, no? So you try to start at the lowest possible concentration muna, kasi that might have an effect already, no? So your goal might be achievable already with that low dose, so you don't need really to add. If you think that the body needs to get more, then you add more few drops.
Okay. How about stuffy nose? So that's a very common problem. Do we diffuse or do we do topical? Pag ganyan?
Actually, it depends also on what will work best for your kid. Because ako, sa mga kids ko, they don't like the inhalers. They don't like the inhalers. Kasi what I do for my allergic rhinitis, I sometimes apply it on my blanket. I use RC pala. I use RC on my blanket, and then I cover my face with it. But my kids, they don't like it. So diffusing would be more helpful for them. But ako kasi mabilis ma-decongest yung nose ko if I use inhale or even from the bottle. So what will work best for your kid? There's no strict rule on whether to use direct inhalation from the bottle or inhaler or diffuser or massaging. Although massage is really one of the best ways to target all those health issues because it clarifies your lymph, your circulation. It helps them feel at ease, 'di ba? So if the mind is not stressed, the balance of the body will follow. So regardless of the cause or the massage is really something very useful. Okay, so you massage and then you diffuse, or actually sometimes you don't even have to diffuse it kasi the mere massage can already make you inhale the essential oils, diba? So it really depends, but there's no strict protocol for that. You can even do steam inhalation, diba? Steam inhalation is very good, but I don't advise using minty oils because it's very, very strong. So when I do steam inhalation, I use mild oil. I use copaiba lang actually for inhalation because it's very mild and it can help ease the swelling inside the nose. So you put in a in a basin with warm water, you can put Epsom salt or regular any sea salt, not iodized salt, any sea salt or Himalayan salt, and then you put one drop copaiba and then you mix it and then you cover the head with a towel and then you inhale it. No, so that's very good to do before sleeping so that they sleep better. But I don't recommend that for children below 4 years old because they might put their hand inside the warm water. No, so just be very cautious when it comes to that. But yeah, steam inhalation is very, very good to decongest the nose. Because anything warm, actually, if you don't want to, for kids below 3 years old, you can use warm compress naman. Warm compress, so towel, same mixture, warm water with Epsom salt, with copaiba, then you put a towel, and then you wring it, and then you apply here on the nostrils para ma-warm up yung sinuses. If warmth can open up everything that's bara. No? So warmth is very a key also to decongesting the sinuses. So either compress or steam inhalation depending on the age of your child.
Yeah. So I think that should cover it, and we've already taken up so much of your time. So
Okay.
so if you guys want pre-diluted oils, we have the Kid Sense line as well, which is now available in the Philippines, the Kid Sense line. So diluted Digize is Tamigize,
Tamigize, yes.
and then
Yeah.
diluted RC is like Sniffle E.
Sniffle ease, yes.
And then Aoi has helichrysum. I think there was a question earlier about nosebleeds because that's a common,
Oh, yeah.
diba? So what do you use for that, Doc?
Actually, my second child is a nose bleeder, as in grabe talaga. No? So what I do, besides the ice pack, kaya pala kinuha ko to from the ref. The sodium chloride solution, I'm not sure if you can see. So you can get this from the pharmacy. This has natural salt in it and then just distilled water. I add siguro in this is 30 ml. I add maybe 5 drops helichrysum here. And then when talagang nagbi-bleed siya, I tilt her head and then I squeeze it inside para the helichrysum will go inside also. And then I apply cypress on the left side of the arm. If it's not really, if it's really very bad nose bleeding. But of course, you should always, you should check also with your doctor if there's no other causes of nose bleeding. Okay? Kasi may child lang talaga is really very sensitive to heat. Pag nainitan talaga, nag-nosebleed talaga siya. Kasi when you're exposed to heat, everything opens up. So that's why there's bleeding. So that's what I do. So this is very helpful. Yung sodium chloride na nasal drops and then I put helichrysum. Kasi the tip is pointed so it easily goes to the nose. Kasi pag helichrysum mismo yung papatak mo, matagal, di ba? Nagbi-bleed na nga, tapos matagal pa pumatak. So this is a fast way to help the bleeding subside.
Thank you so much. I think that covers everything. Other protocols, you can find it in our Facebook group, Hush Angels Sanctuary. You can just use the search bar. We have over 3 years of mommy experiences. So you can find whatever you want there. And andun din yung list of spicy oils to avoid and stuff like that. So madami doon. Just use the search bar, okay? You can find it there. So thank you so much, Doc. So thank you everyone
Thank
for
you
coming
also.
and have a blessed
Happy Sunday.
okay. For those pending requests in Hush, you can message your leaders. So some leaders are moderators, your golds, platinum. So just go ahead and message them. Make sure that you have answered the questions. So sometimes there's no member number. We clear that. We clear that, so we don't get backlogs. So thank you. Thank you so
Thank
much.
you. Thank you, everyone.
Bye.
Bye.